Good afternoon. I wanted to meet with you today to discuss a current update of what's going on in our community with regards to the coronavirus. The first thing I would like to do is thank each and every one of you who are taking this matter seriously, those of you who are staying home and doing the shelter-in-place orders that have been put out by our governor and our Board of Health. As you know, this is a very serious matter. For those of you who have not been taking this as serious as you should, I would want to encourage you to remember how important it is, because if you're out and about going around the community, you very well could be causing other folks to get sick, bringing it home to your family or to your friends, and we don't want any of that to happen. It is very important that we make sure that we work together to keep our community safe. So again, to those of you who have been doing the things that have been ordered, thank you very much. For those of you who have businesses, we know how much it is difficult for you to be doing this at this time, that you are struggling, and we understand that. And we're going to work together to get through this in order that we'll all be able to come out on the other side in a much better position than we are today. As you know, the President of the United States just a couple of days ago has made a recommendation that everyone across the country extend their stay-home orders until April 30th of this year. In addition to that, we all know that our governor has put in place an order that requires everyone to stay home, to conduct yourself only in matters that are essential to the community, otherwise that you stay out of the public sector, and if you are in the public sector, that you, of course, practice social distancing. His order is currently set to expire on April 7th. However, most of us believe that he will be extending that. It may run at the same time that the President's does, or it could be longer. It'll be based upon the circumstances of our community. However, it most likely will be extended. Presently, our healthcare professionals are telling us that the peak in our nearby community of Indianapolis is going to occur in about 2 weeks. We believe that based upon the data that most likely our community will follow shortly thereafter and maybe also go another 2 weeks. So we're going to be in this for a while, but it is very important again that we stick together and work together in order to make sure that we keep our community safe as it should be. I have spoken to the leadership of our 2 local hospitals, and they tell me that at the present time that they feel like they are doing well. They are, like many communities across the country, are in need of additional materials and supplies as they continue to use these on a rather quick basis. They do have COVID patients presently in both of our hospitals. However, they're doing a great job, and the healthcare workers that are working there are also doing a good job, and we certainly want to thank all of them for what they're doing. At the same time, they tell us that they have the possibility of being able to expand more beds if they need those. Both physical facilities of St. Vincent's and Community Hospital have that capacity, and they are preparing for that in the event that we have a surge beyond what we've been having recently. In the state of Indiana, about 60% of all ICU beds are presently being used. We're not that high here yet in Madison County, but we do have the capacity to meet the needs as they move forward, so long as we stay on top of this and do the mitigation that we need to be doing. As you know today, or you may not know, but at 9 o'clock this morning, the Madison County Board of Health advised that we had had an additional 9 cases from yesterday. That we also have, that means at this present time, 38 cases here in Madison County, positive cases, and of course we've had 1 death. So each day over the last 5 days it has went up exponentially, and so it's very important again that we adhere to the stay-at-home rules, because those help keep down the spread, and that's what we of course want to do. It's really important when you think about that just 9 days ago we only had 2 cases. A few moments ago, before I started this, I looked at the national news, and we presently have 3,500 deaths in the United States already. You probably heard the sobering news just a couple of days ago by Dr. Anthony Fauci, who told us that with the current model and the data that we're looking at, even if we continue to do the things we're doing, that we could experience in the United States anywhere between 100 and 200,000 deaths. And so it's very real, and we want to make sure that we continue to do everything that we can do in order to remain safe. The very good news, of course, is that this will pass, and it'll pass a lot quicker if we do the things that we're being told to do by the federal and the state government and our local department and boards of health. And again, we know that it's asking a lot. We know it's difficult. We know you're running out of things to do at home and so forth. But again, it's very important that we adhere to these rules and regulations in order that we can all remain safe. If you happen to be an individual who is required to work because of providing of essential services, or maybe you're working in one of the locations that is allowed to be open because of the needed products, such as pharmacies or grocery stores, we ask that you do everything possible to try to mitigate yourself in terms of making sure that you keep social distancing and that you keep your distance from customers as they come in. And at the same time, we ask that the customers that are coming to your facility make sure that you respect the distance of these folks, because remember, they're seeing people every few minutes throughout their entire shift, and you may only be bumping into one or two when you're out. So you want to make sure that you stay your distance to make sure that those folks are well protected as well. Here in the city of Anderson, our government continues to operate. We continue to have folks that are either at work here locally at the various buildings that we operate, or that they're working remotely. I have sent a number of folks home to work remotely. About 40% or so of our workforce has been sent home in order to ensure the social distancing that we need. We're also using alternating shifts when possible, and alternating days and hours to bring some folks in while other folks can go home and away from the area for a period of time and work remotely in order to be able to, again, protect themselves and their families. Our areas of public safety, such as our police and fire departments, continue to operate. I'm happy to report that our police and fire continue to be well staffed. We have folks that are staying well. We've had very few folks have to stay home because of any type of sickness at all. And so we're in a position to respond to all emergencies and needs through the departments as are needed. We do ask that if you need police or fire assistance, that you only do so in emergency matters. That if it's a non-emergency matter, that you call the police department or the fire department. At the police department, I would suggest that you call the number 765-648-6700. That will get you to the front desk, and they will be able to provide information that will assist you with non-emergency services if needed. The fire department, if you need non-emergency services, can be reached at 765-648-6600. And likewise, someone there will walk you through whatever you need that's non-emergency in nature. At the same time, our utility office continues to serve folks. We are open presently Monday through Friday. We have changed it by 1 hour. The hours now are from 9 o'clock in the morning till 5 o'clock in the evening. We still have the drive-through available, even though we're asking you not to use the drive-through if at all possible. You can pay your bills online. You can also pay it through the telephone. Online, you go to www.cityofanderson.com. And at that website, you will find a fairly easy program to work through to be able to pay. You can pay by credit card, debit card, or by e-check, and there's no cost to do those things. There's also on our website and Facebook page, as well as running on Anderson TV, directions as to how you work through that program if you haven't done it before. Or, of course, you can call the utility office as well. Our utility office telephone number is 765-648-6187. If you'd like to talk to those folks, and they'll also assist you in explaining to you how you can use that program. You, of course, also can pay by mail. If you are going to pay through the drive-through, you can either pay it after hours at a drop box we have there. We also have another drop box out on 7th Street that you can use. If you go through during the office hours and you work with an individual, they'll be working with you through the glass. They still, of course, have to handle money and so forth, so we would ask, if at all possible, that you acquire money orders whenever you can. Those can be acquired from a number of sources here in the community that are still available and open. The cost of those run from about 50 cents to $1 a piece, and hopefully you will be able to pick up one of those rather than handling cash that could be something that could be contagious or could pass a germ either to yourself or to some of our workers. So again, money orders are certainly preferred. Right now, again, that drive-through is open, even though we may, as we go down the road, depending on how things unfold, we might close that down, but right now it's still open. Also want to remind everybody, as we've discussed in the past, that at the present time, while we want you to pay your bills, it's important you do so because we want you to keep up on those bills if at all possible. But at the same time, if for some reason you can't, we're not going to cut your services at this time. So that's also something that could occur if need be. We hope again that you will pay if you can, however. Also, you can pay, as I said, by telephone. The number that you call, it's a Telelink number that takes you into a menu. That number is 765-648-6527. We also, of course, continue to provide our utilities through the work of our efforts of our city employees. For example, our electric folks at Light and Power continue to work. In event of outages, we have our crews set up to be able to go out and fix and repair lines to make sure that you have your services as we move forward. Just the other day, as you know, we had some storms pass through town, and we were able to get our crews out and get the power back up and running pretty quickly. And so we'll continue to do that as we move through this. We also have our park facilities that are available to walk and stretch your legs. We are asking that you not get on any of the equipment. We have taped that off in most instances throughout our parks. Again, we're not able to sanitize those items, so make sure that the kids stay off of those. At the same time, the programs that we were typically running have been shut down currently, and so there won't be any programming, but at the same time, if you have questions, you can certainly contact the park department and they'll let you know what might be available in the future. But for now, everything is shut down. Our CATS and Nifty Lift buses will continue to run. The buses are only going to be running to take folks for essential services, so it's important that you, again, not get out just to go around, but if you need to get to the grocery store, if you need to get to a doctor, so long as you're not sick in terms of being contagious with some virus or some other sickness, then you can ride the bus. At the present time, we're running on our normal schedules. That could change if this circumstance gets worse, but at the present time, we have our normal schedule. If you're using Nifty Lift, you will, like always, you will call up and our dispatchers will schedule an appointment. But again, we ask that you only use that for the necessary and essential items that you need. As always, of course, if you have any questions, you can look at our Facebook page or our web page where you'll be able to get numbers. We have our essential numbers posted, and you'll be able to call those numbers and talk to a live person. Also, if there's, of course, an emergency of any sort, you should continue to call 911 for fire or police emergencies. But again, not emergencies, you should use the numbers that we're providing to you. And if you have other life's challenges that are going on that aren't addressed, some of the things we've talked about here, remember that we still have the 211 number that you can call, and you can get confidential information and referrals from those folks that will assist you in providing other help that you might need. And finally, I'd like to remind all of us that we're in this together, and by working together, we'll be able to get through this on the other side in a much better way if we do stick together. So I'm very proud of this community, proud of what all of you are doing, and look forward to continuing to work together to get through this, and we'll have a much brighter future. So again, God bless each of you and your families in this great city of Anderson.